A fresh embryo transfer is when the embryo is transferred back into the uterus, usually 5 days after the egg collection. So the treatment of ovarian stimulation, egg collection, and then embryo transfer is performed as one synchronous treatment. There has been some evidence that in some patients, freezing the embryos may bring benefit. And what we're doing there is segmenting treatment. So once ovarian stimulation has taken place, the eggs have been collected and fertilized with sperm. When the embryos reach a developmental stage called the blastocyst, which is usually after about 5 days, the embryos are frozen at that stage. The woman will then recover from her IVF cycle, her hormones will return to normal, and then usually the month later, in a much more natural physiological state, the embryos can be transferred once they have been thawed from their frozen state. So when surplus embryos are generated and they're good quality, they can then be frozen. Most comprehensive evidence available today suggests that success rates from frozen embryos are exactly the same as those from fresh embryos. So we strongly recommend that anybody who generates surplus embryos should definitely consider freezing them. The additional advantage is, of course, those embryos will always think you are the age at which they were frozen. So you may come back 5 years later to have those embryos transferred, and they will still give you the chances of success of the younger you. Eggs and embryos are usually frozen initially for about a 10-year period. We very much hope that you come back to use them within those 10 years, but it can be extended beyond that. There is no evidence that the eggs or embryos deteriorate in any way from being frozen, so they will always preserve your fertility into the future.